Hello and welcome to Infinity. I'm Charlie Seraphin. For the next half hour, we're going to be talking about homeopathy. Our guest is Dr. Roger Morrison, a medical doctor who practices homeopathy. Dr. Morrison studied with George Vathulkas, a Greek practitioner who is considered one of the foremost homeopaths in the world. Dr. Morrison is also one of the founders of the Hahnemann Clinic in Berkeley. Homeopathy, what is it?
Homeopathy is a form of natural medicine that was started almost 200 years ago by a German doctor named Samuel Hahnemann that tries to reinforce the body's natural healing processes rather than suppress the symptomatology that may arise.
As a general practitioner, how does that work? Normally, if someone comes in and they come to see you and they have an upset stomach, the normal approach would be to give them something that they could take into their stomach, an antacid or whatever it is that you might prescribe depending on the severity of the illness, and they would take that and suppress the symptoms, be better, and go away happier.
Well, let me give you a more concrete example than that even. What we see very typically happen in most people's medical past is that they were relatively healthy when they were a child, but the first problems they had were on the skin, usually allergic dermatitis or just a rash of some sort. What they do is they go into their doctor's office and they get a cortisone cream, the parents do, and they put the cream on and the rash goes away and everybody's happy for a period of time. Now the next thing that will happen is either the rash will come back or the body will find a different route to try and eliminate whatever toxins or stresses were causing the rash to appear in the first place. And so we may see, instead of the rash coming back, we may see the onset of an allergic asthma or a rhinitis. And if we continue to suppress, the disease goes deeper into the system. This we call the allopathic approach, which comes from two Greek words meaning other suffering, versus homeopathy, which means same suffering. That means instead of trying to go against the direction that the body is working, homeopathy tries to reinforce the direction that the body is working.
Let's keep that example then. It's one that's close to my heart since I have a little boy who has a small rash on his leg, and it's been there for some time. Okay. How do we deal with that if we don't put the cortisone cream on it to make it go away?
Well, what a homeopath would do is take the child and not just be interested in the rash, but try to elicit all of the personality characteristics, the other physical characteristics of this child. So we would want to know the foods that this child craves. We would want to know the sleep pattern and the pattern of the position of the sleep. We would like to know about the temperament, whether he has any other health problems, the family history. Then on the basis of all this information, we would find one natural substance that matches this exact pattern and give it in a very, very tiny dosage orally, which would provoke a defense response on this child's part so that he would not only be rid of his rash on his leg, but also his behavior would improve, his sleep would improve. There would be a general improvement in the entire system.
Is a rash often associated with some particular type of behavior, hyperactivity?
No.
High energy?
No. Generally speaking, people that are ill on the surface, such as the skin, have less problems emotionally. It's only after the rash has been driven in that other problems will tend to arise.
What about food craving? What does that mean?
Well, it seems that the body has an internal logic, and the person has certain sensitivities and awarenesses of his body that are beyond what we would normally expect. In other words, somebody who craves salt, there must be a specific need for that element in their system. Somebody that craves sweets, there are other things that are lacking. So by knowing which things a person craves, we can tell a lot about the underlying metabolism in that person.
Are there things that people eat in larger quantities than might be considered normal that aren't necessarily cravings, that is just a function of diet?
Oh, sure.
If at our house, for example, we drink more apple juice than the average family would drink.
Sure. There can be dietary habits, and that doesn't give us a lot of information.
And it isn't directly related to the skin rash, again, to go back to that specific example.
It can be if there were perhaps, say, an allergy to some food that the child was eating.
What happens when you visit a homeopath?
Most people are struck by the details that we want to know in a homeopathic history. People are used to going to the doctor and sitting with him for maybe 20 minutes at the outside when they go in for a complete history and physical. With a homeopath, you would typically spend an hour and a half, in which at the end of that interview, the most common comment that we hear is that this doctor knows more about you than almost any person has ever found out on all different levels. At the end of that history, the homeopath would then choose one of the homeopathic medicines that fits that particular constitution. And by constitution, I mean both the psychological state and the physical problems that the person has in a combination. He may know the homeopathic remedy immediately, or it may require several hours more of study on the homeopath's part. That's because we have 2,000 different homeopathic remedies that we use, and only one suits that individual and will help him at that time. So it's always a very elaborate process of getting as much information about this person as possible.
What's the nature of homeopathic remedies?
They come from different natural substances, herbs and minerals, and sometimes different animal parts, such as a venom from a bee sting occasionally is used. All of these different substances were taken over the past 200 years since homeopathy has been around and tested in healthy people to see exactly what symptoms will arise if a person takes consistently this particular substance. Then, by writing down in excruciating detail everything that happens to people, healthy people, when they take this substance, we then develop a pattern or a personality or a constitutional type that fits that particular substance. And then when we see a patient that comes in with this exact pattern, we give that substance in a very, very tiny dosage to provoke a defense response in that particular patient and allow them to essentially heal themselves.
When you talk about personality, are we talking about personality in the common sense? And are you, in effect, changing someone's personality?
Well, no, we don't change the personality. What we do is we smooth out the highs and the lows a little bit. It's not abnormal for somebody to be slightly reserved, but if somebody is so reserved in their life that they're unable to make contact with people, they're unable to develop a meaningful relationship, then this goes to the extent of pathology. We don't want to change the personality. We want to help the person out of the knots that they have in order to function more freely. I think everybody has had the experience in their life that they have some sort of problem, internal problem, and they try to change that particular problem. What happens is that the problem will go away, but then several years later they'll notice, well, this is the same problem I was dealing with 5 years ago, but in a slightly different form. It seems that something is necessary to provoke, to release that knot, to allow an improved energy, an improved sense of communication, and homeopathy can very frequently provide that.
Does homeopathy operate on a chemical level, or is it a psychological treatment?
Neither one. It actually works on a very basic energy level. We feel, if you're familiar with Kirlian photographs, it seems that there is a basic underlying energy process in every living system. That's why Kirlian photographs, these are the photographs taken in high-density electronic fields, show that there's a certain field around each living being, be it a plant or an animal or a person. Now, if you take, for example, a leaf and put it in a Kirlian field, you'll get a certain pattern of diffraction in that field, and you can take a picture of it. If you cut that leaf in half and immediately put it in the field, you'll see the exact same pattern as if a whole leaf was was within that photographic field. It seems that there's an energy field that organizes the body in a more fundamental way than either chemistry or psychology. This basic energy system determines not only our health, but our psychological health. And the homeopathic remedies are treated in such a way to bring out certain energetic properties from these substances, which we use to influence the energy system of the patient that we're trying to help. So that as we balance the energy flow in this system, then the disease which has occurred, or the symptoms which have arisen in that person, will naturally fall away. As the energy is corrected, then the body and the psychology may be improved.
We are constantly changing the world we live in our environment. We're cutting leaves in half, and we're introducing chemicals into the air and into the atmosphere. We're changing the foods that we eat on a regular basis and the chemical makeup and composition, molecular makeup of our physical bodies. Are there new remedies that are being discovered in homeopathy?
Yes. I'll give you one very prime example is penicillin. You know, most of the time nowadays a child is not allowed to go through an infection to develop his own internal immunity better. Instead, what happens is that child, or any child, as soon as there's a sign of infection, is put on penicillin. Now, this constant bombardment with antibiotics has very drastic effects on the health, and it's sometimes necessary for us to give these very, very tiny doses of penicillin in order to counteract the negative effect that the penicillin has had on the child. We don't use it in the same way, but we still use it, only to improve the defensive mechanism of somebody that's been negatively influenced by a drug such as this. Not that there's no place for antibiotics, but the abuse of different substances, as you mentioned, has forced us to find new substances, and it's alarming the rate at which we're having to look for new substances because of the rapid changes in our society.
Could that be compared to what is called a penicillin maintenance program, where very small doses of any given antibiotic are given to kind of prevent, we're talking about children, talk about ear infections, which are a real common occurrence, right, and a common thing treated with antibiotics.
Right. Ear infections are one of the mainstay of homeopathic treatment. That's why homeopaths are always family practitioners. We're always taking care of the whole family, and what we see so commonly nowadays is children that have had one ear infection and they're placed on antibiotics, and the ear infection goes away, only to recur very shortly. Actually, many studies that have been done lately seem to show that there's no real influence by the antibiotics in terms of the recovery from the ear infection. But beside that point, what we see is that instead of totally curing the infection in the ear, what seems to happen is the infection is wiped out, but resistance grows among the microorganisms that are within that ear. And we end up with the situation of constantly recurring ear infection. As the child goes on one round of antibiotics after another, eventually leading to this maintenance antibiotic approach, and usually to tubes being placed in the ear. What happens in homeopathy, if we can get the child early enough in the course of this, we not only take away the acute ear infection, but we take away the tendency to repeated ear infections over and over, and avert the need for this constant use of antibiotics.
At the risk of prescribing over the radio, which is something that neither one of us really wants to do, what kinds of substances would be used as opposed to an antibiotic to help rid a child of an ear infection?
Well, as I said before, we have these 2,000 substances that we use. Now, with ear infections, there aren't 2,000 substances for ear infections, but there are as many as 250. And we would always take not only the history of the ear infection, but we'd want to know which side the ear was in, which ear, the left ear, the right ear. Does it usually come on preceded by a cold? Is there usually high fever or not much fever? And we would use sometimes different calcium mineral preparations. Sometimes we would use an herb such as pulsatilla, which is called the wind flower. Many different substances may be indicated, and it's a question of finding the exact right one for that particular child.
Dr. Morrison, is homeopathy accepted by the American Medical Association and traditional medicine in this country?
Well, actually, if you look back, it's interesting. If you look back through the old documents of the American Medical Association, the AMA was originally formed to combat the growth of homeopathy in the United States towards the end of the 1800s. And there's been a traditional sort of a battle with the American Medical Association, which I think is blown over in the past, say, 20 years, as homeopathy was almost eradicated in this country at the beginning of this century. In other places, such as France, in Germany, in England, homeopathy is very well known, and approximately 1/5 of the medical doctors in France use homeopathy. In England, the royal family, Queen Elizabeth and Prince Charles, use almost specifically homeopathic treatments. So you can see there's a big difference between the United States and the European countries. And it's only in the last 20 years that homeopathy has been staging a rebirth in this country.
Is it accepted by insurance companies?
Oh, yes. Homeopathic doctors are the same as any doctors, and we're all well trained in the standard traditional approach to medicine. We've also done further training in this form, this non-toxic form of therapy, and it's not that we will never use what we call the allopathic or the traditional approach to a condition. For example, if somebody comes to us with, say, pneumonia, we use the same laboratory tests, x-rays, to diagnose and to decide how far we can allow this person to go. Very frequently, the homeopathic remedies will more quickly and safely eradicate a pneumonia. But we also know when the situation is getting dangerous, and we know when we have to resort to more toxic forms of treatment. But the idea is, whenever possible, we like to use a more safe and gentle approach, and then if we have to, we go to the more traditional approaches.
When you're dealing with an adult comes in and is having migraine headaches, for example, you can talk to the adult. You can talk about the medical history, you can talk about stress situations, you can talk about lifestyle, diet, and all those other things. When you're dealing with an infant or an extremely young child, it's very difficult for that individual to give you the answers. How does that work? Do you have to rely on the parents?
Yes, we rely very heavily on the parents in such a situation. Of course, migraines don't typically occur in very young children. It seems that very young children can only break down in certain ways, and it's as people get older and more complex, that's when more complex things start to happen. So we rely very much on our own observations, on our physical examination, and on the parents' history to decide in children. It's interesting that you brought up migraine headaches, because that's one of our best areas of result is in headache cases where there's virtually no other form of treatment except for perhaps acupuncture, which can offer such consistent results in these chronic conditions.
The body heals from the inside out.
Exactly.
What does that mean?
We have a homeopathic law of cure, which says that in the course of a real cure, disease will go from within out, from above downward, and in reverse order from which the symptoms occurred. Now, what that very frequently means is that if we see somebody with an asthma, and we treat the asthma, that's inside. In the course of that cure, you remember I said that the suppression of a skin eruption may bring on an asthma. As we treat that asthma in a child with homeopathy, the disease will be driven back out to the skin, and the rash will then reappear for a certain period of time. And then after the rash has appeared, is treated homeopathically, then the rash will also fade. So it's going from within out. Also, we notice that rashes will very typically, if they're being treated by a truly holistic form of medicine, they'll start on the face or they'll start on the body, and they'll go down to the feet or to the legs or out the hands. And lastly is in reverse order that they occurred. What we see is people generally start with minor disorders, and by the suppression of this disorder, then will come on a deeper disorder. So first we'll start out with the rash, then will come the asthma, then by the suppression of the asthma with cortisone and so forth, the person may start to develop deep phobic situations or anxiety about different things that they can't explain, or depressions that don't make any sense in their life. It's only by treating homeopathically we can reverse the direction that this disease is going. So it goes from within out.
Could someone take the basic principles of homeopathy and apply them themselves without a medical doctor or homeopath?
Yes, it is possible to do that. There are books which teach about home care and homeopathy, and many families throughout the past 100 years or so in this country have had old grandmother took care of the whole family using little homeopathic tinctures and could avoid many of the problems developing into more severe conditions. So that still goes on, and we do teach classes on that at the Hahnemann Clinic on family health care with homeopathy.
We've talked about migraine headaches, ear infections, skin rashes, asthma, and some other afflictions. What about broken bones, ruptured appendix, the kinds of things that normally require surgery or casts or traditional treatments?
Absolutely. Homeopathy is only in favor of treating with a safe method when, or the homeopathic method when that's appropriate. It seems that we do best treating a disease with an energetics type of medicine like homeopathy when the disease comes on chronically. But when a disease comes on from a mechanical insult, such as a blow to the arm causing a fracture, that bone has to be set. There's no two ways about it. Sometimes homeopathy can improve the healing time in a fracture such as that, or very frequently we can prevent an early stage appendicitis from going on to a rupture. But typically what we'll do in that case is we'll make the diagnosis, we'll give the remedy, and we'll send the child to the hospital. And en route, very frequently, the pain will disappear, and by the time they get to the emergency room, somebody will say, well, there's no appendicitis now. So we can sometimes avert an appendicitis, but once the condition has gone too far, then surgery is absolutely required.
I have a split-level question. You talked about energy fields earlier. The first part of the question is, how does it work that you take a substance in that can direct energy to a specific part of the body? And the second part of the question is, if in fact this is the way that we function, why do you deal in minute doses? Why don't you give them a big old bushel of stuff to take, whatever they need, and fix it up all right away?
Well, both of those questions are actually answered or with difficulty, but I'll try to explain the whole process, how we use these different substances, how we prepare them. We would take a substance, let's say it's an herb. We would then vibrate it at certain frequencies. We would make a tincture of it, and we'd vibrate that tincture. Then we take a small amount of that final tincture, put it in more distilled water, and vibrate it again at certain frequencies. Now, in this dilution process, what we see is that the Kirlian field, if we take Kirlian photographs again of these substances, the Kirlian field intensifies around each successive what we call potentization. So the homeopathic preparation of these substances both dilutes to rid the toxic side effects of giving, say, a mineral in a strong dosage, and at the same time it brings out these latent energetic properties in the substance so that we can treat more effectively on this level.
The first part of the question again is how that would explain why you would give minute doses.
Right.
How does it work that a substance that goes into the body orally, goes into the stomach and is digested and goes through the system and ends up in the blood, how can you get something that will go to a rash on the foot and isn't going to affect your left earlobe?
It should affect everything.
Okay.
Yeah. Because we're working on this more central energy field, it doesn't matter exactly where the condition is that we're trying to treat. We go to the most basic level, the energy field, and we simply try to strengthen that energy field. Now, once we strengthen that energy field, the body is going to take care of itself. once the energy pattern is stabilized, let's say, we're using a metaphor here, but once there's a balance in the system, that balance will be reflected in improved health on any level, wherever the disease is found.
You've mentioned Kirlian photography a number of times as a proof almost of energy fields, but when homeopathy was first introduced and was being invented, if we can use that word, Kirlian photography wasn't around.
Absolutely.
How did they figure out it was working before they could prove it?
Well, this German physician Hahnemann that I mentioned, he's the one that we've named our homeopathic clinic after here, was the founder of homeopathy. And how it basically happened was he got very disillusioned with the medical practice of his time, and he started to think that he was doing more harm than good for his patients. So he started to think about the very basic principles of medicine, and he thought, if we could find a way to reinforce the tendency of the body, when there's a cold, instead of giving something to dry up the nose, give something that will temporarily cause more of an outpouring of mucus to rid the system of whatever toxins, at that time they just thought in terms of toxins, were affecting it, so that they could get rid of the cold more quickly. So it was reinforcing the body's tendencies. Now, when he was thinking of this, he happened to notice that a child in his neighborhood was very sick with a particular disease. And this child happened to take a very large dosage of a particular substance that was considered poisonous at that time. Now, this child got very sick for a little while, and then was cured not only of the poisoning, but also of the disease that this child had. And the thing that struck Hahnemann was that this poison, when it was given to healthy people, would produce symptoms that were almost exactly the same as that this child had in this chronic disease that she was suffering from. So this whole idea of like curing like, which is the homeopathic idea, homeopathy, same suffering, reinforcing the tendency of the body, it formulated in his mind very strongly. So then what he did was he went around and he got all these friends of his and other doctors that he convinced in this idea, and he started testing these different substances on them. Well, what he found was that he could write down all these symptoms for these substances, and he could decide how to use them. And he would find people that were sick with diseases that were similar to the symptoms caused by these particular substances he was testing. He would give these substances, and he would see cures affected. But they were getting very many toxic results at the same time. So then he simply, on an empirical level, decided to dilute and vibrate these substances. Nobody knows why. If he hadn't done it, homeopathy probably never would have grown up the way it did. By chance, he decided on this method, and it was strictly done on an empirical basis that this was a system that worked. And it's only now that we're beginning to understand that the body has these energy fields. It's only in the past 50 years that any of these ideas have come about.
This is Infinity. Remember to keep your mind open and listen to your heart. I'm Charlie Seraphin. Thank you for listening.